Well, hello and welcome to the International Society of Hair Restoration Surgery World Hair Transplant Repair Day, which is today, November 11th or 11th. And I have the pleasure of having distinguished doctors from Turkey, Dr. Emre Karadeniz, from Egypt, Dr. Shady El-Maghraby, and from Cincinnati, our president of the ISHRS, Dr. Bradley Wolf. So welcome, gentlemen.
Thank you.
Hello.
Good to see you all here. So we're talking about World Hair Transplant Repair Day. So this is an idea that was created back in 2018 by one of our own doctors, Dr. Marcelo Pichon, as an opportunity to give back to patients for problems that we've been seeing in the hair transplant business, and to basically create this repair day where we all come together and provide a pro bono repair for victims that have been suffering problems in hair transplants around the world. But the first thing we want to say, and Dr. Wolf, our president, hair transplants are supposed to be great. Now, describe some of the great things that happen in hair transplants.
Yeah, when done properly in properly selected patients, I mean, the results should be great. And most patients, they're life-changing. And some patients say it's the best thing I've ever done. It's given me more confidence. So there are a lot of positives when we talk about hair restoration surgery. But unfortunately, there are some negatives. We used to remove a strip of tissue from the back, and that was more of a surgical procedure, and only surgeons or licensed doctors did it. But when FUE, or follicular unit excision, became the standard, then that allowed, although it's the same surgery, we're going full thickness, we're taking out a piece of skin, we're just taking out little pieces. So really only doctors or licensed professionals should be able to do it, but it's construed as something less invasive. So there are unlicensed people doing it all over the world, and that has led to poor results because they're not trained physicians, they're not trained providers, they don't have the judgment, and they're just doing people off the street. So because of that, we've seen a lot of bad results.
But Emre, a good hair transplant, what is a good hair transplant? What should a patient expect to see?
A good hair transplant, in my opinion, means a couple of things. The first one is good indication. So it's doing the right treatment for the right patient. The other thing is naturalness. So although we work in the hair business and we love to give hair, baldness is not the worst thing that can happen to someone. Having an unnatural set of hair is usually much worse than being bald. So being competent enough to provide a natural result is very critical. And lastly, and what some people forget is that we are not adding any new hairs. We are redistributing what is left. And therefore, using what is called the donor capacity economically and without wasting the hairs is very, very critical.
Right. And, Shady, I think, talking about these, good hair transplants, what are some of the things that, are the obvious things? Like when a patient has a hair transplant, we expect a nice, as Dr. Karadeniz said, it should look natural. So what are the problems that, we see, and in your area, you see a lot of these, hair transplants that necessitate these repairs. What are the problems that you're seeing that necessitate a repair? What kind of issues do you see?
Hi, Ricardo. Actually, the most important problem in the hairline is the design. I've seen many patients coming from black market clinics. Male patients, they have female hairline. They look more like transgenders. This hairline should be fixed. Also, the distribution. Actually, a lot of patients doesn't know that the hairline should not be detectable. So if you have a natural hairline after a hair transplant, it should look completely natural. So if someone who doesn't know you, who doesn't know that you were bald, he should not detect that you have a hair transplant. But actually, most of the patients that we see every day at the airports, at the supermarkets, in the streets, when you know that they have a hair transplant, there is something wrong happened during the procedure. It might be the design of the hairline. It might be the distribution or the direction of the hair. So there are many steps in the procedure that might cause an unnatural hairline. And it's always easier to do from the beginning a natural hairline than to repair and remove the hair and transplant new natural looking hair.
Now, the World Hair Transplant Repair Day was created primarily to give back to the community and to repair some of these problems that you're describing. But is it obvious to patients? I mean, are they so bad that they're obvious to patients? Dr. Karadeniz, Dr. Wolf?
The hairline, generally, yes. I mean, everybody's used to seeing generally a natural hairline. Even a 6 or 7 year old knows if dad comes home and doesn't look right. We all know. We may not know the way we have different parameters to make a hairline. Those official parameters may not be known, but someone knows because they see it. Everybody sees a lot of people. So if it's not natural, they know it. It doesn't take that much to detect an abnormal hairline, and that's where someone who's trained in this profession and who has the best interest of the patient at heart. That the ISHRS, their core purpose is improving the lives of patients with hair loss. That's the first sentence in our core purpose: improving the lives of patients with hair loss. So really, everything else should stem from that. We want to improve the lives. We don't want to make it worse. Like Emre said, it's more natural to have no hair and be naturally bald. And it's what I call hair transplant pattern hair loss, where the pattern of hair loss is from a hair transplant, and it's obviously doesn't look natural.
And why do you think that we're seeing so much of these bad results, today? Why is that occurring in your own countries or in your own backyard in Cincinnati and Turkey and Egypt? Dr. Karadeniz, you're in Turkey where, more hair transplants are done probably in any place in the world. Why are we seeing so much of these problems?
Yeah, the primary reason I see is that there is no routine training for hair transplant surgery at medical residency. So you don't get naturally trained surgeons that actually are experts in this field. So people have to learn from each other or trial and error, which is both a slow process, and also it doesn't cover the demand. There's a huge demand for hair restoration surgery versus very few number of self-trained or surgeons. So then we get what I call the fake market, or what we call the ghost market. And then we get newly graduated doctors employed to oversee a team of what we call technicians who have absolutely no training themselves as well. And so we have a hair transplant, but in reality, it's a ghost hair transplant. It's empty, and there's no real know-how involved in this. So the average quality decreased over the years due to that.
And I think, when you talk about a ghost surgery, this happens anywhere in Cincinnati and Florida, where basically, the doctor's not doing the surgery. He's kind of a ghost somewhere else, and he delegates the procedure to individuals that may or may not know how to do the procedure. Are you seeing?
Right. Yeah, I would like to add there that, delegation is a huge problem, but together with that, ghost surgeons that are not just ghosts because they delegate, but they're also ghosts because they absolutely have no experience and knowledge. So there's also a frequent mistake that, patients have started to learn over the years that they should fight against delegation and look for a surgeon, but they don't yet fully understand that they could be actually hit by a ghost surgeon. So there is a surgeon, but this surgeon actually has absolutely no training and no experience.
he might sign a piece of paper that, you know, he was there in the office somewhere, and there could be 10 surgeries going on by non-doctors. And I think we see this I think you see it in Cincinnati, you see it in Egypt. Is that correct, doctors? Wolf and Maghraby?
Yeah, it's different, I think, in the United States. We don't have big centers where there's just one doctor or there's no doctor. It's more common that a doctor is a legitimate doctor, maybe plastic surgeon or cosmetic, and he doesn't know how to do it. He just buys the machine, and the people who make the machine provide him with the assistant. So he's in his office, he's there, but he delegates the actual surgery to unlicensed assistants. And there are certain things you can delegate. You can delegate an injection of an antibiotic to somebody who isn't licensed, but you can't delegate the administration of a controlled substance or the administration of anesthesia. And you can't delegate the practice of medicine and surgery. The doctor has to do it. So there's some argument. Is it legal in some places? Is it not really? Ethically, it's not right anywhere to delegate the practice of medicine and surgery, because there are decisions that need to be made that can affect the long-term welfare of the patient. So it's all over, but it's in different forms in different places. I think one of the most motivations is money. People want to make money, and there's a lot of people want to do it, and people want to do it fast, and the big business has gotten into it. And so that's true of medicine, I think, in general. But I mean, I know, we're just trying to educate the people on what to look for to get a good hair transplant.
And that is true in Florida. In Florida also, they've ruled that, you cannot delegate, the follicular unit excision to a technician, even under supervision. Even if I say, here, you do it, it's still, they're not a licensed person that has authority to do surgery, because, FUE, or follicular unit excision, is a surgical procedure where you're cutting through the skin full thickness to remove a live graft that's going to be retransplanted to the scalp. So that is even true in Florida, and I think even in Turkey and in Egypt, correct, Shady?
Yeah, exactly, Ricardo. The biggest problem is that many patients, they don't know that the doctors will not operate them. So they go to these clinics, the black market clinics. They forget to ask the most important question: who will do the surgery? Who will do the incision? And I know celebrities who went to black market clinics, and they thought that it's the most famous and most professional doctor, and the doctor only drew his hairline, and then he became a ghost surgeon. He disappeared. So this, I believe this is the most important problem. And actually, after our campaign, Fight the Fight campaign, now I got a lot of patients. During the consultation, they ask me, who will perform the surgery? Who will do the incisions? So I'm happy that our campaign now has people are listening, people are thinking. In the past, it's normal when you go to a doctor in any specialty, he does the surgery by himself. But in the hair transplantation, as you know, in the black market, most surgeons doesn't perform anything.
And that was the Fight the Fight campaign was a fight the fraudulent, illicit, global hair transplants across the world. That was a campaign that we started several years back to try to educate the public, which we're trying to do today, about how to find a clinic and how to be aware of some of these clinics so you don't fall victim to an improper hair transplant. So let's talk about some of these red flags. Let's talk about, let's each describe one of the red flags that are in your country, in your areas. Like if you see this or you hear this, that's a red flag. So give us some red flags that are occurring in your country.
Actually, from the advertisements and the black market clinics, you will not find a name of a doctor. You will find the name of a clinic, and in their market plan, they market about their instruments. So they have new names to attract people, new techniques like Sapphire FUE, Nano FUE, and this stuff to attract people. But there is no doctor.
So no doctor's name. If you can't see the doctor's name there, that's a red flag. Okay, if you don't see it advertised, if you just see great results, pretty pictures, but no doctor, that's a concern. All right. What else, Emre? Do you have another thing?
An unlimited number of grafts.
Unlimited number of grafts. Okay, Emre, how about you? What things are on the top of your list?
Some more of those red flags is like if they, you may see a doctor, like they put 5 no-name doctors on the front of the website, and usually you see this picture with the arms like this and side by side. Yeah, so you see that, that's a red flag. If the doctor's doing that and you have 5, 6 of those doctors together, see how likely is it to actually find 6 well-trained doctors in the same clinic? So that's another red flag, but it's a hidden one. Another one is...
So they advertise a doctor and they advertise 6 of them, but they're not going to be there.
Yeah, and even if they are, they have absolutely no knowledge. So they'll just be there, but nothing else. So another red flag is like they have excellent before and after pictures, thousands of them that are, at a professional would easily tell that these cannot be achieved. They're too good to be true, and they're like played, photoshopped pictures. Another one is thousands of 5-star reviews, tens of thousands of reviews. We all know that no matter how well you practice, you're going to get a mixture of reviews. Some of them complaining, most of them happy, but never 100%. So if you you see like so many of those reviews, tens of thousands of, and all 5-star, you have to understand these companies have a review team just to manage those reviews.
Right.
Yeah.
And
yeah.
Brad,
also, yeah, you see unrealistic claims in the marketing, and this is all marketing. So you don't know who the doctor is, but it's all marketing. They're unrealistic claims like scarless surgery, like painless surgery, like you said, these huge number of grafts. A lot of the clinics will pick you up, and you can look at the price too. Price is important. If it's just absurdly low, that's a red flag. They pick you up at the airport, hotel, and all the extras. Also, when you go to, I think, any of our websites and you click on our names, you'll find our CVs. You'll find what we've done. We're proud of it. We're not hiding anything. So that certainly is a red flag, and just marketing that just doesn't seem right, because anybody can, with this puffery and I'm the greatest and we do this special technique that nobody's ever done before, use special tools that we invented. That's just not realistic. I mean, there's a way to practice medicine. I do all my own consultations. Sometimes you can have slick salesmen that they're trying to sell it to you, and they're not really doing what's in your best interest. So you should look at who is doing the consultation too. And obviously, when you go in, ask who's doing the surgery. But there are a lot of signs that it's not legitimate.
And Emre, you mentioned about education. Doctors don't have any know-how. And obviously the ISHRS is the world's largest organization and educational society for doctors. And, on the website at ishrs.org, every doctor is listed on there, and on there it can tell you, the years that they've been a member and the years and the number of meetings that they've attended. So it's a good way for patients to actually see, has this doctor attended many meetings? Have they been to meetings? Are they keeping up with their knowledge and education and training? Because I think it is important for doctors to continue their education, right? I mean, that's why we go to these meetings, to learn from each other, to pick up new things, new tips, new tricks, to improve our techniques. And we do it to educate, younger doctors as well on the importance of, proper hairline, so that they don't end up with these, ridiculous things that we see, occurring in these fake clinics today. And that's, I think, the biggest thing that we're trying to educate patients is, these fraudulent or fake and illicit clinics, because, wherever something is done illegally, and illegally can have many terms, meaning that, it's not properly or not licensed, or it's just, wrong. Okay, so I think it's proper to make sure that we educate our members, and obviously education is a big key. Brad?
Yeah, there are ways that Emre's right. There aren't formal residencies for hair restoration. It's done in dermatology. There's some exposure in some cosmetic residencies, but the ISHRS does offer fellowships. They're 9 to 12-month fellowships. We recently just started offering preceptorships that can go from 3 days to 3 months. So the ISHRS at its core, that's its main strength, is offering educational opportunities. We just finished our yearly conference in India last week. It was a wonderful educational opportunity, but throughout the year, we provide many educational opportunities to try to train the doctors and the staff in the world about how it's done correctly.
Mm-hmm. And with the Fight the Fight campaign, are you seeing, are you seeing that patients are, Shady, you mentioned it in Egypt, patients are asking you who's going to do the surgery. Emre, in Turkey, are you finding a shift of education in terms of patients trying to be a little bit more aware of, who's going to do the surgery, or, has education played a role a little bit in terms of making them think?
They are, but we have to see that the fake companies are not stupid either. So they fight back. So they adapt to the situation. So like in the last maybe 5-6 years, patients started asking about, where's the doctor? Is the doctor going to be involved in my surgery? So they quickly adjusted and found these ghost surgeons so they can like stick in the room, so the surgeon can kind of walk around, accommodate the patient, so they feel there is this surgeon. So they quickly adapted. So now the patients have to do a more sophisticated research. So they have to look not only if there's a doctor or not, but who's this doctor? Does this doctor have any past in hair restoration surgery? Is he a member of any of these prestigious organizations, beginning with ISHRS, board membership, American board? And are they attending scientific meetings? Are they doing any publications? So they have to start looking even deeper, because now the fake clinics are also getting stronger. And and oftentimes patients look at these superficial marketing, before and after pictures, how actively social media is used, reviews, but these fake clinics oftentimes cover up these areas, and even much better than real clinics. So they can get it much better than real surgeons get it. So patients have to now be active and actually see behind that marketing, which is not so easy. And ISHRS, as usual, will have an active role in helping patients see behind those curtains.
Yeah, and that's a big key. And marketing is definitely, that sells. And I look at some online pictures and I'm impressed, with some of the before and after photos. It kind of makes it hard for a person that is just really out there searching online and Googling, and they see these beautiful before and after pictures. It's very difficult not to get like lured in. So, we as a society trying to educate and differentiate, how to pick apart, the little nuances of, okay, yes, it's a great before and after picture, but, examine all the other things, who the doctor is, their years of training, do they attend meetings, they member of the ISHRS, also the American Board of Hair Restoration Surgery. I think that's important also, because it shows that you really dedicated your life to education and to this field, which is hair restoration surgery. Okay.
Yeah,
right.
I can comment.
Sure. Jump right in.
Yeah, actually, there are two main types of patients. The first type is the best type, who is looking for the credentials of the surgeon and who will do the surgery and which steps that you will do and which steps that you will delegate to your assistants. But on the other side, there are type of patients who only are looking for the lowest prices. And these type of patients are very hard to be educated. We tell them everything, but actually they are only looking for best results at the lowest price. And usually they refer to the black market clinics, and they don't get what they are looking for, but they get what they pay for.
Yeah, there are, as Shady says, there are different types of patients, some that are very informed, but their hair losses can be an emotional problem for especially young people, young men, young women, but much more young men. And they see this as a solution to their problems. And so they're very gullible, and they'll listen to these marketing ploys. And they have to be recognized and educated. It's in my office. It's a matter. I've never told anybody they need to have surgery or told them you should have surgery. I educate them, tell them what can be done. Some patients, they have too much loss. Their donor hair is really bad, and you can do as great a job as can be done, but will it satisfy them? With all the variables. So that's something that needs to be. You need to talk to the patient to find out, what's best for them and do what's in their best interest. And I find that I still see this, that patients think any doctor who does something is good. So he's a doctor, he does hair transplants, he must be as good as the next one. There's no big difference. So I'll just go to the local guy or the one that does the most advertising. And that's not true. There's a huge difference in the quality you can get. That's why we have Hair Transplant Repair Day, because the quality of some of these clinics that are charging so little and having unlicensed people do the surgery is terrible, and people need the repair. So the ISHRS and these great doctors that volunteer their time are helping these patients who have fallen into this trap, whatever the reason may be. They fall into this trap, and I think it's had an effect in my practice. And I see more people saying, "I went to this doctor and he didn't do he said someone else did it." And people, I think, are becoming aware of what's right and what's wrong.
Right. And patients that, have become a victim of an improper clinic and gotten a bad result that they didn't expect can go to the ISHRS website at hairtransplantrepairday.org. And there are a list of participating doctors that will provide pro bono surgeries, for, repair. And, we certainly encourage patients to, research those clinics that can provide that support, because that is a mission of the ISHRS, is to provide proper education, training, and to educate the public about what's happening. Now, we mentioned a couple things about the role of the physician and the role of the technician. So let's talk about, what is the role of the technician in hair transplantation surgery versus what the physician should do. So let's comment a little bit about that. Emre, if you want to make a couple comments about that.
Yeah, so typically, if we're talking about any type of surgery, and it doesn't have to be hair restoration surgery, if you're doing incisions, cuts on the human body, it has to be a surgeon. So there's no doubt about that. There are some, buts and ifs, but this is the general
Right.
thing I'd like to say. Okay, there are some evolvements in how it's practiced in the world. So we may have to adapt to those as well. But the classical knowledge we need to emphasize here is that incisions, surgeon. And in Turkey, where I practice, I have to add that actually, although they're not always applied strictly, laws are quite clear and strict. And in Turkey, you can't even call a medical doctor surgeon unless they have surgical training. So I see oftentimes in black market clinics claiming surgeon, or like saying hair transplant surgeon, with absolutely no training, with a doctor never even holding a scalpel in his hand. So, so that's how I would like to summarize it.
Yeah.
I agree. Yeah, I agree with Ali. and he covered the part of the surgeries that incisions should be done by the physician himself. And there is another important thing that is totally missed in the black market clinics or by technicians. Before the surgery, even the medical history.
Yes.
Usually technicians and these clinics where the doctor is ghost doctor and he doesn't appear, they don't take proper medical history, and many things are missed. That's why now we see very bad complications and life-threatening complications that we didn't see in the past. It's now happening. So this is very important, and also for young doctors to learn about what's important in the medical history of patients.
Right. Okay. Well, we've kind of gone through a lot discussing several things about World Hair Transplant Repair Day, why it was created, and the Fight the FIGHT campaign. And we're kind of coming near the end. Dr. Wolf, as president of the ISHRS, do you want to give any final comments about our educational programs and what we as a society are doing to, help people out there?
Yes, well, thanks, Ricardo, for being the moderator. But yeah, the ISHR's strength is education. There are a number of different societies that have meetings, but the ISHRS we're involved all year. There are many committees. It's a very well organized society that works every day for the benefits of the patients and training. And not only training, but we have the Fight the FIGHT and other campaigns to educate doctors and patients. And again, our core purpose is improving the lives of patients with hair loss. And it's if someone has surgery who never should have had surgery, that certainly isn't improving their lives. And as Shady said, patients can be treated with medications also. There's some good medications that treat hair loss. It doesn't grow hair back, but it can stop hair loss. So we should be a lot of the problems with hair transplantation because doctors are delegating, but we need to be real doctors and talk to patients, get to know patients, and do the right thing. Sometimes that's not to do surgery. So it's just we have to be considerate doctors with the patient's best interest always is our number one responsibility.
Yeah, and I think, wherever you go, whether you travel to Turkey, to Egypt, to, Iran, India, Florida, California, the main thing I think for patients for us to make sure is, to go to somebody that is well educated in this field, that can provide you with the proper hairline, that is going to do the right thing for you. And the only way to ensure that is, to find that doctor that's properly educated. And it's difficult to know, and who's educated and who's not, but the ISHRS does have that data on file, and it's publicly available, at ishrs.org, and you can research the doctors that are members there in Turkey, in Egypt, or any country, and see, how many meetings they've attended, how many years they've been a member, and also are they a diplomat of the American Board of Hair Restoration Surgery or not. And that's another website as well, whether they're also there, because all these things I think are important to ensure that your doctor is really on the top of education and has a passion for this field. Any other comments, gentlemen?
Yeah, I have a comment for
Sure.
the patients. Yeah, the patients should know that not all the complications and all the bad surgeries could be repaired. So before going for a surgery, do your homework well, know the doctor, know his credentials before going to a certain clinic, because I have seen a lot of patients, we cannot repair, we just repair them for SMP to camouflage what happened in their scalp.
Okay. Emre, any final comments?
Yeah, my last comment would be to just remind once again that the Fight the FIGHT campaign, fighting the fraudulent and fake clinics, is for the patient's benefit. And
Right.
this fight cannot be won without the collaboration of the physicians that have been spending years on this and the patients. So you can't do it against the patient. It has to be done together. So the patients, with the help of our organization, with the help of the education we provide, I recommend and encourage patients taking an active role and kind of trying to see behind the curtains and doing their research and always thinking, when they see this marketing, when they do their research, always important is who's saying it, not just what is said, but who's saying it. And as you correctly stated, that question can be answered to an important context by checking membership, CVs, past attending of the medical meetings, scientific activities, and education.
Well, I think that summarizes it very well. In this November 11th, which is the ISHRS World Hair Transplant Repair Day, where our organization and doctors are providing pro bono surgeries to patients around the world to correct any problems that have occurred from these fake clinics. So I thank you all for joining us today to help educate patients on November 11th, 11/11, on the World Hair Transplant Repair Day. Thank you very much.
Thank you. Thank you.
Thank you.
Thank you.